Greetings and welcome to the United States Transhumanist Party Virtual Enlightenment Salon. My name is Gennady Stoliarov II, and I am the chairman of the U.S. Transhumanist Party. Here we hold conversations with some of the world's leading thinkers in longevity, science, technology, philosophy, and politics. Like the philosophers of the Age of Enlightenment, we aim to connect every field of human endeavor and arrive at new insights to achieve longer lives, greater rationality, and the progress of our civilization. Greetings, ladies and gentlemen, and welcome to our U.S. Transhumanist Party Virtual Enlightenment Salon of May 21st, 2023. Today, we have an excellent conversation in store for you about stem cell research, regenerative medicine, patient advocacy, and an event that brings all of these themes together, which is the World Stem Cell Summit. Joining us today is our panel of U.S. Transhumanist Party officers and members. It includes our current Vice Chairman and Director of Visual Art, Art Ramon Garcia, our Legislative Director, Jason Geringer, our Director of Longevity Outreach, Ben Ballweg, our friend and allied member and founder of London Futurists, David Wood, and our guest of honor today is Bernard Siegel, or Bernie Siegel. Bernie is a Florida attorney. He is also the executive director of the nonprofit Regenerative Medicine Foundation and the founder of the newly formed Healthspan Action Coalition. He is also the organizer of the World Stem Cell Summit. And with us today also is Melissa King, who is the co-founder and chief operating officer of the Healthspan Action Coalition. So welcome to all of our panelists and guests. And Bernie, the World Stem Cell Summit is a huge event in the regenerative medicine space. So could you please tell us a bit more about it? What motivated you to start this series of events, which have been happening for many years now, and also tell us a bit about your own history in patient advocacy and the work that you have done in that realm.
Well, thank you, Gennady, and it's great to be with the Transhumanist Party today. There's no reason in the world that I should be doing any of this. One could make that argument. I was a practicing lawyer in Miami, Florida, for about 27 years when I got involved in perhaps one of the strangest cases that ever existed, when a group claimed they cloned a baby. It was the Raelian movement, and they made an announcement on world television back in the very end of 2002. It was taken quite seriously. They made the announcement in South Florida, and as I was watching CNN at the end of the year, it occurred to me that someone should test the truth of this claim. Because at the time, you might remember, in 2002, 2003, human cloning was thought to be something that is just around the corner. And I had understood, as a patient advocate and a cancer survivor way back then, in 2002, I had colon cancer in 1997, that stem cells were related to this issue of cloning in some way, shape, or form, and that this group was stampeding lawmakers and panicking people that human cloning, a sledgehammer term, was around the corner. So when I heard them make this announcement, it occurred to me they just proclaimed there was the first clone baby. They had presented this to the world. Were not doing the DNA test they promised anyone. And it occurred to me that someone should test the truth of the claim. Yes, this was just an outrageous claim, and a lot of people thought it was a publicity stunt, yet this group had testified in Congress and appeared before the National Academy of Sciences and were taken very seriously. So on New Year's Eve 2002, I actually decided to file pro se a motion for temporary guardian of the alleged cloned child. Anyone in the state who is aware of a neglected or endangered child has the right to file something to bring it to the court's attention. And I thought, well, maybe this will be the first case to look after a human clone. And wouldn't that be interesting? So I filed it, and then it was New Year's Eve, and that evening, as I'm getting ready to go out to dinner with my wife across the Chiron, it said, Florida attorney seeks custody of clone baby. What had happened is that I had gotten myself caught up in an international cause celeb, a very serious one. And all of a sudden, I was thrust in the limelight to be a spokesperson in favor of something called therapeutic cloning, or SCNT, somatic cell nuclear transfer, but against human reproductive cloning, which certainly this group didn't seem to have the capacity, but if they did have the capacity, weren't treating the alleged clone child in a very mindful way. It turned into, Gennady, a giant cause celeb. Much to my shock, I was placed under a huge amount of scrutiny and media coverage. And in 30 days, I was able to establish that the group that was making the claim was essentially a sham. It wasn't a real organization. The matter was dismissed, but at that point in time, the entire debate about human cloning had reached stratospheric and hype, and it was perceived that a bubble had been burst. I was ready to go back to my practice of law, but I was reached out to by Rudolf Janisch at MIT and Dolly the sheep's father, Ian Wilmot. And they invited me to the first meeting for the International Society for Stem Cell Research, saying that I was essentially the only person standing up at the time to support freedom of scientific research. And I took them up on the offer. And that's when I had a great revelation at that first meeting of 650 scientists in that field in Washington, that amongst all of them, there didn't seem to be a single patient advocate amongst them. Yet this was an area of scientific research that was under extreme threat by Luddites, by religious fanatics or organized religion in some cases, and there was a giant societal clash. And at the end of the meeting, the top scientists of the world prevailed upon me to stand up for the research and agreed to join a scientific advisory board of an organization that would do so. So I ended up, long story short, leaving my practice of law. Still had a kid in college, but I thought this seemed to be a higher calling, and I had a platform at that time. I was not afraid to debate folks on television that, when sometimes scientists get their opportunity to do so, might speak scientifically against a political pro that's going to speak in talking points. So I became a spokesperson for freedom of scientific research, and the realization that if we're going to get anything done, you have to get public support. So through a number of advocacy efforts, we were able to protect the field of stem cell research in the United Nations from being banned by World Treaty, which was a gambit at the time of the Bush administration and the Vatican largely. And we were able to save it in the legal committee by a single vote. And my organization staged a press conference for the UN, a meeting in the Dag Hammarskjöld Auditorium, presenting the top scientists of the world. And it was a major, major event. During that meeting, we formulated the idea of bringing patients seriously into this field, patient advocates. And that's been the main part of my work for 20 years, to organize a patient advocacy movement to accelerate now, not just embryonic stem cell research, but the entire field of cell therapies being another pillar of medicine. If you think about drugs and biologics, medical devices, cell therapies, with a lot of things that haven't been figured out, regulation, approval, reimbursement. How are we going to get that to move forward? Whose ox is being gored? This was the problem. So what emerged was now a 20-year effort of bringing and uniting all the stakeholders in an event called the World Stem Cell Summit, Originally, it was the Stem Cell Policy and Advocacy Summit, one at Baylor College of Medicine in Houston and another at Stanford. And it turns out over 20 years in organizing it, it's been a movable feast. My work and the work of the Regenerative Medicine Foundation, a nonprofit, has been in Washington trying to move the regulatory needle, protect the field, work in state initiatives, especially when they were trying to ban embryonic stem cell research, but it's also an international movement. We've been able to bring in patients, their organizations, medical philanthropies, scientists, the nascent, but now very burgeoning industry surrounding this and the enabling technologies. Along the way, the summit has allowed me, as sort of in my promotional mode, to send out 100, 150 invitations to speakers every single year and speak in many locations around the world and give many interviews from a patient advocacy standpoint and a legal standpoint on this. And as a result, we know a lot of people. We have an actionable network unlike any other, I would submit, on the planet. And everyone deals with hierarchies, but my organization has dealt not only with the very top, but the middle and arguably the bottom, the patients themselves. And that's the world that I've inhabited for 20 years. I'm rather fanatical about it. I've spoken at 2 congresses for World Freedom for Scientific Research in Rome, but also spoke at a Vatican science conference where I was afraid I might end up like Bruno, burnt at the stake, but they were very gracious to me. So this is the world I inhabit. And along the way, I've met humanists and transhumanists, and I have a great deal of curiosity and interest in this because I consider myself a futurist in many respects, a friend of Aubrey de Grey's, and I've invited him, and I think he's spoken to about 15 World Stem Cell Summits. And the latest is the HealthSpan Action Coalition, but I'll stop a moment and take a breath.
Thank you very much for these introductory remarks, Bernie, and for anybody who would like to register to attend the World Stem Cell Summit or just find out what events will be transpiring there, what speakers will be there, please go to worldstemcellsummit.com. And also for anybody who is interested in the work of the HealthSpan Action Coalition, please go to healthspanaction.org. I think both of these are quite remarkable and important endeavors. So, Bernie, I'm curious in regard to your debunking of the Raelians' claims. Do you think that it was plausible for anybody at that time to have created a cloned human being, especially given that cloned sheep and other mammals had been created or generated? Or do you think the technology just wasn't sufficiently advanced at that time? And how would you contrast that with the technology available today? If somebody wanted to engage in reproductive human cloning, would that be possible today, or are we still not there yet?
Through the lens of 2002 and 2003, it was very much thought that cloning is around the corner. A science writer, Brian Alexander, had written a book on biotechnology. It was an interesting volume, but he made it, I remember him writing in his book that fertility doctors are laughing in their back offices or laboratories how easy it's going to be to clone a human being. And indeed, there were people like Rael and Dr. Basilier, his sidekick, or his spokesperson, that was involved, and Dr. Zavos and others that were proclaiming that they were going to pursue this, and it was taken quite seriously at the time. I remember having a surprising conversation with Robert Lanza and Mike West, who were then at Advanced Cell Therapies, during a company that was doing cloning of cows. And I had a conversation. Well, I understand, Dr. West, Dr. Lanza, it's very unsafe. This can't be done in humans. And they said, no, we're just doing some papers. We're having a lot of success in cloning cows. So whether it could be done safely or not wasn't crystal clear or not then. Of course, what we know now is another story. And the twisting saga of cloning includes our friend Dr. Woo-Suk Wong in Korea and the proclamation that he was doing therapeutic cloning. And I met him. I actually presented him into the United Nations and in the Senate offices at one time. And it turns out that his ability to do SCNT were not real. Not real. He might have been able to do it with a dog, which he did, but not certainly a human. So here we are. We have the technology today, of course, makes this much more feasible. I mean, we have cloned monkeys now that barely stirred a ripple of interest, whereas in 2003 it would have been mass hysteria with this announcement. So, but could is another thing, should is another thing. And what I learned along the way is that it's appropriate that science have boundaries. But what those boundaries are and who draws the boundaries, that's the big question that's constantly on my mind of what we can do and what we can't do.
Very interesting. And I think we can delve into some of those boundaries to a greater extent as our salon continues. I also wanted to give the opportunity to Melissa King to provide some introductory remarks regarding the HealthSpan Action Coalition and her work in essentially supporting a major ballot initiative in California that was able to provide a large amount of funding to regenerative medicine research.
Thank you so much, Gennady, and I apologize. I am still in transit, but I will just speak very briefly. It's an honor to be here. And you've heard from Bernie, who has been such a leader in the regenerative medicine field and the stem cell research field, as you've heard, just based on the fact that he's been there since the beginning and providing legal counsel to the field, no less. What I have done has been in tandem with Bernie's work for a number of those years, for about 20 of those years, having worked, as Gennady said, on 2 different statewide ballot initiatives in California to first form the California Institute for Regenerative Medicine, which is our state stem cell research, stem cell and other related research agency right here in California, funded with general obligation bonds. We went back to the ballot in 2020 and got another $5.5 billion. We're now at a total of $8.5 billion in funding from the states in California. And there's absolutely no way to accomplish that without a coalition of patient advocates, first and foremost, as trusted sources of information for patients and family members of patients suffering with chronic illnesses and diseases, and also coalition members from the scientific community, always elected and appointed officials, and many other leaders, including people from organizations like yours. Bernie is someone that I've worked with over the course of the past 20 years, encountering him first as a supporter of Prop 71 in 2004, by which we created CIRM. And then later in 2020, he actually sat on the board of the Prop 14 campaign that was for the additional $5.5 billion in funding. And I've always had the pleasure of working closely with him in advocacy roles, and also just watching him navigate the very complex waters around patient advocacy, scientific and medical research, how those two interact with each other, with industry, with government, and with various forms of funding. And now the two of us we get to do it together again, related to HealthSpan and longevity. And there's a lot yet to do, and I'm looking forward to working with Bernie and also with you, Gennady. Thank you so much.
Wonderful. Thank you, Melissa. We appreciate those remarks and all of the excellent efforts that both you and Bernie undertook to get this impressive amount of funding dedicated to regenerative medicine. And now let us go to questions from our panel. Now, Jason had stated that Bernie is out there doing the things that we support as the U.S.
My new hero.
Party. So, Jason, I will give you the floor now to ask your question.
I'd just like to say you're awesome. And, I mean, the things that we support, you're actually out there doing. It's like we're talking the talk, but you're out there walking it. That's awesome. The only question I got off the top of my head has to do with like the supply. Is there an issue with getting the supply of the stem cells, or I had heard that one of the big political issues, that some of the Republicans have is that they're worried about the material taken from abortions to be used for science or something. And then I also heard something that we don't even have to do that at all, that there's like enough or something. I was wondering if you could maybe, fill in the blanks on that.
Yeah, thank you, Jason. Of course, the field of embryonic stem cell research, and for that matter, fetal tissue research, has long been controversial. And the idea that a handful of cells, that an embryo that was created through IVF, and otherwise, if it's not implanted, would be discarded as medical waste, could be used as a source of embryonic stem cells and had the ability to be pluripotent, could turn into any kind of tissue in the human body. That discovery, it was like an earthquake. And in the United States, it was the issue over these embryos became hijacked into the abortion debate in the United States, almost as a proxy issue. So those social conservative movement were saying, no, you can't do this. It crosses a moral boundary, as opposed to those that say, well, these are embryos that will never be implanted in the womb, and who really owns them? Does the state own them, or does the couple that created them? And could they be donated for scientific research? So the debate over embryonic stem cells still exists, but not necessarily in the same context, because circa 2007 or so, it might have been later, Dr. Shinya Yamanaka in Kyoto University won a Nobel Prize because he had his research was able to end up creating something called induced pluripotent stem cells, where you could take one of your ordinary skin cells and introduce some viral vectors and have it turn into an embryonic type state. And if that's the case, it avoids the destruction of an embryo. It actually opens up other astonishing scientific issues. It was thought by many that these cells would be genomically unstable and maybe could not be used for therapy. But the science has advanced so incredibly, it seems that these cells are a much easier way to access, manufacture, and they're actually being studied for therapeutic purposes and also as tools for drug discovery. After all, Jason, we could create from your own cells in a dish to test drugs that would match yourself. Fetal tissue is something else again. How would we have gotten a polio vaccine? How many? There are so many uses already for fetal tissue that otherwise would be discarded as medical waste. But yet, to some, it's a moral or religious boundary to do this. So that's when I talk about how boundaries work. And and can these boundaries be moved, and the cultural issues and the nation state issues around this and the geopolitical issues. This is the world that in which my groups have been operating for years. And there are no easy answers to reach a consensus on this. But what we've learned is with these converging technologies that we have, it is Toffler's future shock is here right now. And how are we all going to deal with it?
Yes, indeed. And I'm quite glad that this thread of conversation included mention of Shinya Yamanaka's work on induced pluripotent stem cells, because this was an example of technology transcending one of the culture war debates, where the concerns by some on the American political right, whether or not they were justified, they were essentially rendered obsolete by the arrival of iPSC technology. And this is an area where the U.S. Transhumanist Party takes a great interest, because we are on the lookout for these kinds of innovative technological solutions that can transcend existing political fault lines and render large wedge issues in the contemporary discourse obsolete. Because one reason why the wedge issues are wedge issues is because they're based on different moral frameworks or different entrenched partisan views that are very hard to move in the current technological and societal climate. But if we can create or see the creation of some sort of technological workaround that in principle ought to satisfy everybody, then we render a serious controversy of our time obsolete. So thank you for that discussion, Bernie. And now let us go to David Wood for his question.
Well, first I have to say thanks so much to the US Transhumanist Party for selecting this topic. It is such an important topic with so much potential. And it's great that we have Bernie and Melissa, who are deeply immersed in this space, to give us not just some casual comments, but some very deeply thought through comments about the potential for stem cells. Bernie, you were talking a minute or two ago about some of the sensitivities about using fetal stem cells. Can I ask about something slightly similar, which is placental stem cells? You know, when a child is born, a great deal of what grew inside the mother's womb isn't actually in the child, it's in the placenta. And by default, we tend to throw it down the drain. But I've heard that there is potentially a great deal of goodness inside their stem cells. So is that something that will be covered at the World Stem Cell Summit, the possibilities of treatments using these placental cells?
Absolutely. Placental cells, cord blood, birth tissue has been shown to have a robust population of cells, mesenchymal stem cells, MSCs, or as Dr. Kaplan now calls them, medicinal signaling cells. And they're just hundreds, if not 1,000, clinical trials around the world utilizing these cells. The accessibility to that tissue has created a whole industry of cord blood and placental cells being banked, and cord blood's family banking as well as public banking. So that's part and parcel of the World Stem Cell Summit, which is really a conference more about future medicine now, and certainly regenerative medicine, that we're going to be able to regrow damaged tissue and organs, and using tissue engineering and pluripotent cells and all of these incredible technologies. So yes, the short answer is yes. We have the head of the Perinatal Stem Cell Society, Kyle Citrullo, is going to be on the program. We have someone from Duke University, where they're actually using these types of cells in an autism trial that is quite fascinating. We also have to understand that stem cells in society have not only become just a brand, but a commodity, and that There are a lot of clinics around that are saying they're offering stem cell treatments that are not approved by the FDA, or they might not even be living cells there. So everyone has to be careful before they get stem cells, allegedly stem cells being injected into their system and paying thousands and thousands of dollars and getting ripped off. So that's the world we live in too, and we have to be good consumers here.
I mean, how can consumers know whether a treatment offered by somebody is likely to work or whether it's likely to be a rip-off with?
Well, sure. You have to be an informed consumer, and it's asking, is this treatment been approved by the Food and Drug Administration? Is this part of a clinical trial? Why is this something that is reimbursable? If it's not, why is it not reimbursable? Do you have any evidence to show that this really works? All of those things are available on all sorts of websites, including the Food and Drug Administration. And that's where you can't fall for the hype. You really have to look at this. And it answers in a way, it actually is, there's evidence of the great divide between the scientific orthodoxy that of course, believes that we must go through safety and efficacy before we use these cells and understand the mechanisms of action, and the huge demand of the public that sees stem cells as a salvation type technology, and have almost created a consumer movement for this, where the person on the street doesn't understand necessarily what a stem cell is, but it's something that might help their own lives, their loved ones, and their friends and family, right? And so stem cells have almost become an avatar for many things in society, I would submit, including biotechnology in general. So yes, consumers have to be aware of this, but that same type of understanding that bursts forth in the political debate over embryonic stem cells created in a societal context that hope was being crushed by the foes of this. Well, as a result, that's where Prop 71, Melissa was talking about Prop 71 and Prop 14, and I was very honored to be on that board of Prop 14 and have known Bob Klein, who is the architect of all this, a brilliant patient advocate, brilliant Stanford-educated lawyer, patient advocate, that was the principal architect in moving forth thousands of ballot signatures to become $15 billion of taxpayer money devoted to this. So the reason I digress, and I usually digress a lot, but I'll come back to a point, is I wanted to make sure that the audience understands that this didn't happen in a vacuum. And where the demand was created was with the public and public appreciation. Now, we didn't really talk about what the Health Span Action Coalition is, and I wanted to get to that because, in having conversed with many years with Aubrey and other scientists, especially stem cell scientists in the space of longevity or health span, healthy lifespan, we realized that the same movement that propelled laws all over around the world protecting stem cell research and all of the disease-specific organizations, whether they were tiny little organizations or large medical philanthropies, they united together. Well, now that we have an ICD code that recognizes that aging is a treatable medical condition, that is like a starting gun in January 2020. And all those resources that are going into longevity, what does the public really understand about that, and who is it for? So Melissa and I considered that and understood the field that we had worked in building coalitions for years should certainly understand that they are all stakeholders in health span, and that branding it just as longevity doesn't necessarily represent the health equity, distributive justice issues, and that everyone is going to be able to take advantage of this. And even in the womb, if Dr. Evan Snyder is going to be speaking at our conference, talks about, longevity is created in the womb. All right. There's not a single chronic medical condition where aging is not a factor or a risk factor. And someone who has a spinal cord injury is worried about dying young, right? Because of all of what they are going through. So when you hear these patient stories and over again and realize that we are part of a larger international movement, Melissa and I decided to take a stab at creating a global movement supporting this. Now, right now, if you go to healthspanaction.com, you'll see 70 organizations have joined in a few months, including Wake Forest Institute for Regenerative Medicine, the largest single institute for regenerative medicine in the planet, 450 employees, and in Winston-Salem, North Carolina, surprisingly. That's where we're doing this summit, and people who come to it are going to have their eyes open and stunned at what is there and how they're working with health span and aging issues as well. So this is something new, and I would submit and ask those in the Transhumanist Party that are patient advocates or have connections to that group, if there's a meritorious nonprofit organization that is interested in this, who wants to join the coalition, there are no dues, who wants a seat at the table, this is what we're trying to create.
Excellent. Thank you very much, Bernie. And now we have a question from Rudy Hoffman, who wonders along the lines of our prior discussion on induced pluripotent stem cells and how they helped defuse some of the controversy over embryonic stem cell research. Do you think the culture war debates continue on stem cell research more generally, or has the field become a lot more accepted by the mainstream, including people of all sorts of political persuasions?
Rudy, it's a great question, and I do believe stem cell research is much, much more accepted and is not considered in the same controversial way. In the United States Congress, there's quite a consensus in support of regenerative medicine and cell therapies in general. If you take out the term embryonic stem cells from the descriptor and just talk about cell therapies, there's hardly any lawmaker, I would say, that is going to be opposed to this, because there's so much of it. It's not about necessarily the type of cell, is it? It's whether these cells can be wielded effectively in a curative fashion. But that doesn't mean that culture wars don't play into this. So I was waiting for the question so I could show my dog-eared copy of Future Shock to you. Now, when I was a student in college, probably all of you are too young to remember, maybe not David, but Future Shock by Toffler was the rage. And it was extremely influential to me because I just like to read this quote, because this is where we are today. Now imagine not merely an individual, but an entire society, an entire generation, including its weakest, least intelligent, and most irrational members, suddenly transported into this new world. That's sort of my mantra of my worldview. And what the work that we've dealt with in dealing with some folks of more fundamental religious beliefs or disquieted by the future, understanding the zeitgeist and the dystopian future, terrified of AI. My own view are all of these technologies. I'm not a techno-utopian. I'm a techno-realist. These are coming. They're here. Whether you like it or not, they're here. And they're going to be wielded in geopolitical ways, in nation state ways. So what are we going to do about that? All right. Maybe there's certainly a time for moratoriums on aspects, and that might work, and we might come to a consensus or not. But bottom line is these should be wielded for a meritorious purpose. And we are in favor of finding and funding meritorious uses for these technologies and bringing them in sooner rather than later. Because these are the things that are going to, so it tends to take 30 years to cure a human of diabetes after you cure a mouse, but it might be compacted into 2 years, or 3 years, or months because of these technologies. And this has got to be the goal. But how do you deal with a world of angst and concern and with all the fear and opposition and disruption that these technologies have? So, maybe that's a job for the Transhumanist Party to figure out.
Mm-hmm. Yes, indeed. And these are definitely important matters to consider. Rudy Hoffman writes that he thinks all of us, even those who embrace change and technology, are still having future shock, and he feels that he cannot keep up with the latest and greatest. Of course, as a transhumanist, and by the way, he says his bicycle is named Modernity because he embraces the new third generation carbon fiber that makes this bike almost magical. So Rudy is one of the early adopters of a lot of emerging technologies. And as a transhumanist, I see myself as welcoming at least the vast majority of technological advancements that have a clear use case to benefit humans in everyday life, as well as improve the infrastructure with which our society and our civilization operate. Now, this concept of future shock is interesting because different people will react differently to especially the perceived sudden arrival of a technology. So my first reaction tends to actually be, great, this will help break through some persistent log jams in our society. It will get us out of some sort of rut of stagnation. It will help us solve long-standing problems. So as a transhumanist, I generally tend to see the status quo as being riskier than the new world that a technology will bring. But I understand that not everybody is of that mindset, and particularly people who have, let's say, fundamentalist religious convictions. And that's not, of course, the entire spectrum of religious convictions, but the people who cling very tightly to a specific doctrine, or people who have extreme political partisan views and are really invested in one side or the other of a particular present day controversy, and they don't see a way of getting past that. Those people tend to have a very reactionary outlook toward emerging technologies. So would you say, Bernie, that a good approach would be to kind of gently guide such people to see some of the beneficial applications of the technologies, hopefully even in advance of those technologies coming about, so that they could see the opportunities, for instance, with stem cells and cell therapy having the potential to cure certain disabilities, reverse the consequences of certain devastating diseases. And if people of those persuasions see that these are really objectives that we all have in common, and these are objectives that don't conflict with their moral frameworks, are they more likely to perhaps not be as shocked and accept the technologies, at least within a certain context?
Well, that's interesting the way you put it, but I would say that there's nothing gentle about any of this. I've, in the course of building a World Stem Cell Summit, we bring on board patients, and the narratives of some of these stories are incredibly painful to learn. One organization is called Taylor's Tale, about a little girl that had Batten's disease and was enrolled in a clinical trial with Stem Cells Inc. And she remarkably, in this early stage clinical trial, showed remarkable improvement, but the trial collapsed because the company ran out of money. I've heard 2 or 3 other stories like that just in the last 2 months I was fortunate to be on a panel with Peter Marks, the head of SIBR, and talked about the crushing angst of people that have no hope, that have hope, but there's systemic problems the way we get our medicine approved, that there's nothing that could be done. Nothing could be done of a childhood genetic disease that had awful outcomes. So what are we going to do? Well, at least one of the things we can do is to bring these stories forward, to understand that without a regulatory system that keeps up with innovation, without understanding that there has to be funding for the valley of death of these companies, to understand that we live in a commercial society, that we have to be able to move this forward somehow, and what's the cost and the longevity dividend, as they say. Without bringing this to the public's attention, most of the world doesn't even know. A lot of the world's in grinding poverty. How do they know that these types of salvation medicines might be available in an abundant supply? It's a tremendous education campaign, and there's so much politics in the World Health Organization. And it's not only we're talking about Luddites or religious opponents, but how about industrial components in the competitive industry and the way things are done in the insurance industry? So it's like peeling an onion, Gennady. I've been at this 20 years, and it means going to the legislature. It means understanding the stakeholders and each of their points of view. And in the most effective way that Melissa King and I have found, of course, historically, is building coalitions. And coalitions, if deployed, it's not really you're deploying it. They are deploying themselves in a unified way. Just like coalitions brought and dealt with the FDA and AIDS, HIV, or the polio vaccine, or women's health and breast cancer, or COVID. This is where we are today. But with all of these technologies that are way beyond the scope of anyone who's not reading New Scientist every week, I'll say, or whatever, or keeping up with this, and most of us don't, because it's too complicated. So what are we going to do about that?
Yes, indeed. And thank you for highlighting the multifaceted nature of this communication challenge and the advocacy challenge. Now, David, you have some comments that you could offer about future shock as well.
Well, my question now is about adoption. How can we encourage more adoption of this? And you're very rightly pointed out, Bernie, that there are treatments which will appeal to everybody, even the religiously conservative or others who are frightened or who dislike any idea of indefinite life extension, and they feel it's maybe blasphemous or impossible. They may still be very interested in having their knees repaired or their hips repaired or possibly their skin enhanced by these stem cell treatments. So this is less of a future shock. It's more of a understandable thing. And we all know from those of us who study technology marketing, companies may fail in this valley of death, which you called it, this gap between enthusiasm from early visionaries, but not making it through to the mainstream adoption. And one of the ways to counteract that is to have a practical application. So I'm very pleased to hear these examples, but the other drawback, of course, to adoption is the cost. And people keep saying to me, when I'm telling them I'm going to the World Stem Cell Summit in a couple of weeks' time, they say, that sounds interesting, but isn't it so expensive? It's only for the rich people. These treatments, first of all, they're not very reliable. And second, they cost an arm and a leg. So you may give an arm and a leg to get your knees repaired. Is that really worth it? So what's your answer to the cost question?
Well, the cost question is, talk about a systemic problem, right? All the money that goes into R&D, who's going to pay in the end? Is the taxpayer going to pay? Does they expect the family to pay if they don't have resources? It's just an issue. What can we do? If we really bring this to the forefront It should be ubiquitous. Cells, trillions of cells that can have a medicinal effect. That's where the real promise is. And 20 years ago, when naively people were thinking of, as the proponents and as an advocate, I was naive. I was, oh, 5 or 10 years, we're going to get this. It's going to be incredible. I was believing the hype that I was hearing. No, this is going to require incredible technological prowess to bring this just into being, much less get it around the world. But the point is, there's so much human suffering. There's so much, and it's so universal to be a common denominator of all humans are healing. Tell me someone that doesn't support healing, no matter how much they might be a Luddite or a fanatic. You might not like the person across the street to be healed, but in themselves, they're looking at healing. Well, this is what I'm saying. If that's a universal thought, then why can't we bring this to the forefront, which circles around to the longevity field, David? And I put this to you and Gennady and others. How is the messaging really going with that? Is it effective? Do you feel the resistance? Is everyone saluting the flag of longevity? Is that going to push us across the finish line? I'm not so sure about that. But that one thing that might is a healthy lifespan, because I haven't heard anyone say, I wouldn't want to live a little longer and healthier.
Well, I definitely think most people would be supportive of increasing healthy lifespan. I think the longevity message has had greater public acceptance, certainly since the middle of the first decade of this century, when I first became involved in longevity activism. Right now, I would say when encountering an ordinary member of the general public, there's about a 50% probability of eliciting a mildly favorable response when discussing indefinite life extension through science and technology, and another 50% of eliciting a skeptical response. So somebody might bring up the typical arguments about overpopulation or boredom or the technology not being equitably available. But those are fairly easy objections to counter in my experience. And I haven't really encountered any sophisticated objections to radical life extension. So I think we have a much more receptive general public, but the receptiveness is at the point of, well, this would be nice to have, at least according to about half of the population. But those same people may not necessarily see it as being around the corner yet. And in part, that is because a lot of work needs to be done, and more practical demonstrations of cures for previously intractable diseases or documented biological age reversal would be needed to get that broader acceptance. And I wanted also to have Ben Ballweg ask a question or make a comment along these lines, since he is our Director of Longevity Outreach. So Ben, please go ahead.
Well, Bernie, no lie, I am just barely keeping up, and some would say otherwise, on the latest in what's going on in the science of keeping us healthy longer. Please tell us the awesome things in stem cell and regenerative medicine that have been happening in, say, the last year that have really piqued your curiosity.
That is such a good question. It's like every day of the week, there is some announcement or pronouncement that is absolutely astonishing. What intrigues me at the moment are the advancements in chronic kidney disease and in the eye, and the potential of being able to cure various forms of blindness. In animal studies, in animal studies, we're showing that we can extend the lives of animals, healthy lives. In the last 12 months, there have been multiple studies. Don't ask me to reference them in here. Some of you might be able to do so. But those things have really piqued my interest, that this can be applied to human beings. And how are we going to make the leap across the species boundary? And how are we going to do it sooner than later? I'm just going to have to leave it on the broadest terms, and saying that it seems like every type of cell has its niche, has its right place that is being used. I had a meeting with Dr. Anthony Atala, who leads the Wake Forest Institute for Regenerative Medicine. And he showed me in a long presentation something with amnion cells, amnion fluid cells. And the fact that these cells appear to have almost pluripotent capabilities, meaning that they can turn into some completely different cell of the human body. And the study that he was showing me showed the rebuilding of cartilage using these cells. Now, these cells are abundant and abundantly available. Could they actually be part of the orthopedist toolkit to be able to just regrow cartilage with the proper injection and the proper maintenance of the site? That's the implications of this on human beings in the here and now. So it's every day that I open up my computer, I'm more and more agog about this. And that's the nice thing about the World Stem Cell Summit, is it's not just meant as a scientific conference. It's meant for the public and media to be able to understand this. We run it contemporaneously with something called the Regenerative Medicine Essentials course that I co-chair with Dr. Atala and Joan Shank, who's the director of education at Wake Forest, that people go spend 3 days in the next building and can learn every aspect about the whole field of regenerative medicine. Anyone who goes to the summit or this will actually get a certificate, a signed certificate, albeit it's an attachment to an email. They have participated in this course, and that is a master's level course to students at Wake Forest. So this is available to anyone that comes to Winston-Salem, besides getting to meet people like Brian Kennedy and David Wood and others that are going to, Aubrey and others that are going to be there at this event, in a tightly networked event that has about 500 people there. It's not in the convention center, it's in the beautiful biotech place. Historically, we've ran about meetings that have 1,500 attendees, but this is the first live meeting since the pandemic. So it's a little narrower in scope. But you know, I hope you can get out there, because then you will interact with the scientists themselves and you can ask these questions.
Yes, indeed. Thank you, Bernie. And now I would invite Art Ramon Garcia to ask a question.
Yeah, Bernie, thanks for coming on the show. Yeah, back in 2019, I got diagnosed with like severe osteoarthritis of my hip joints. And when I asked this sports medicine doctor about stem cells, he practically laughed at me and told me I needed to go to France to get any sort of treatment like that. All he wanted to do was give me cortisone shots and say, keep running until you need a hip joint replacement. So, you know, it's been many years now. I mean, is there any sort of stem cell treatment that's been FDA approved and that insurances will cover? I mean, the fact that insurances, you know, if they don't cover something, it makes it very difficult financially. You know, what are your thoughts on that, and what's your advocacy in that area?
Well, the answer, to my knowledge, is no. There's no approved stem cell treatment. There are plenty of docs in the orthobiologics space that might be using something called platelet-rich plasma, which is not stem cells, but it is cell-based or related, and there are a lot of studies on that. And of course, there are a lot of clinical trials for osteoarthritis that one could join, and there's a lot of evidence showing that there's improvement, but not a single treatment has been able to overcome all the hurdles. It's interesting. I'm aware of a company that is going to be going through a medical device approach in a way at bedside, essentially, to be able to extract stem cells from one part of the body, and the direction that they want to go in, the treatment is osteoarthritis. So when I speak to these doctors, yes, they're all enthusiastic and they're cheering it on, but nothing has hit the finish line yet. And you might find your local chiropractor is ready to give you an injection with his nurse because he can't do it himself because he's not licensed to do it. Don't do that, because you're gonna end up losing weight in your wallet.
Interesting.
Thank you.
Go ahead.
Oh, I just said thank you. Thank you.
Yes. So we would hope that more of these therapies can get across the finish line and receive FDA approval in the coming months and years. But of course, we know that FDA approval is often a far too protracted process because of the enormous costs involved in some of the late-stage clinical trials, as well as often the shortage of examiners to review a lot of the applications. And it does seem like there ought to be some alternative, reliable way to distinguish the more legitimate, scientifically based offerings from the quacks and the charlatans. Of course, quacks and charlatans have existed in medicine for centuries, and in some cases they predated the legitimate evidence-based medicine. But are there any criteria or signs to look out for with regard to, say, a clinical trial or even a treatment that hasn't yet been approved by the FDA, but it does show some empirical support and some theoretical basis for why it ought to produce the kinds of results that are being claimed?
So first, I think that we can all understand that the FDA is incredibly under-resourced for the task at hand. And CBER is now hiring quite a number of personnel to try to fill in the gap, because we're not going to get cell therapies through anytime soon and any abundance if the FDA doesn't have enough examiners and personnel to get the job done. So that's just a fact of life, and that is also an advocacy position that we have to be advocates for. So that's the first point. And Gennady, what was your second point?
Yes, my second point was, are there any methods or any signs by which one could distinguish treatments that, while they have not yet been approved by the FDA, would have a lot of both theoretical and empirical legitimacy behind them, versus treatments that are dubious because there's not much of a scientific basis for expecting that they would work, at least in the way that they are offered or being administered?
First, as a consumer, I'd be looking at the sponsor of the trial and understanding if this is an academic center, that naturally would give me a much stronger comfort level than whether it was just a small company trial, especially if they're going to be charging a lot of money for your participation, because they're entitled to charge a certain amount of money as overhead and clinicians and people involved with it. But if you're paying for this yourself, be careful, be very careful to pay money to join a clinical trial. Number one. I think there is a movement in the United States and in the states that are recognizing that the onerous prospect of something going through the FDA is too challenging. And we've seen the right to try movement be embraced in federal law in the states to various degrees of success. And of course, the orthodoxy looks down on this as an encroachment on FDA authority. But there is a route that if there's no hope, as they say, forlorn hope, that one can get themselves in an access to some of these novel medicines and treatments. But this has barely emerged on the scene. It's more of a theory. To me, it seems more of a theory than something that is widely known or being widely utilized yet.
Yes, and of course, the U.S. Transhumanist Party has strongly supported right to try legislation, but we are seeing fairly limited utilization of those prerogatives, even in states where the state laws have been amended to allow a right to try. And there is a limited federal right to try act. My understanding is a major problem. Well, it's twofold. One is with insurance coverage for these treatments, but another aspect of the problem is sometimes the manufacturers of the drugs or other treatments themselves may not readily make them available even to patients who qualify under the right to try statutes because they're afraid of some sort of liability for distributing a treatment that's not FDA approved.
I agree. To everything you said, absolutely. There, and that's why it might be it might make lawmakers feel good and proponents of a right to try, as far as patients, happy that this is these laws are on the books. But it's one thing you can't force a manufacturer or to participate in any of this.
Yes, indeed. So we need to keep thinking of innovative solutions that would increase access to a broader patient constituency and perhaps give the manufacturers more of a comfort level to offer these treatments. Could there be some sort of liability shield in these kinds of right to try situations where, in addition to the patient having the right to try, a manufacturer can be assured of some extent of immunity, barring gross negligence or fraud, if the manufacturer offers the treatment to the patient?
I would speculate, I haven't studied it, but I don't think the big pharmaceutical industry players really are cheerleaders of right to try, is my guess. Some of you may know better than I.
I wouldn't be surprised, and that would be unfortunate, and that calls into question the entire distribution system for a lot of the medicines that people get today. But of course, that is a much broader topic that we could devote an entire salon to.
Sometimes I feel like every day I get up, I'm trying to boil the ocean. I'm lucky if I can boil some hot tea. But it's a rough job, but some of us have to do it, right?
Indeed, indeed. And
Yep.
Jason was wondering, with regard to some possibilities for augmenting the Health Span Action Coalition and bringing new organizations into it. So, Jason, could you pose your question in this regard?
Yeah. First of all, it's awesome that you're a lawyer because, I love the way lawyers think. I like the way scientists think, too, but lawyers are, and we definitely need some more lawyers in the USGP. I mean, what you're doing is like literally right up our alley. I mean, we should so support you and what you're doing because, it's so much so we even had a referendum a couple of years ago about whether we was just going to be a, longevity, action thing, but we ended up voting to be, a political party because we want to do so much more. But that's how much, you're in our lane. You know what I mean? I'd love to help you. I like the idea of this building a coalition, and we actually probably know a lot of people. We've had contact with a lot of different organizations. I'd be happy to try to reach out to them and bring them together for you. I think you'd be perfect to lead something like this, because at the end of the day, you kind of need a lawyer, and I mean, we can advocate, we can, spread the word and all that, but that doesn't really do it. At the end of the day, somebody's got to go to court, kind of,
Right. One of my favorite expressions was Frederick Douglass, who said, of course, power seeds nothing without a demand, never has, never will, right? So you have to be able to make a demand. And of course, there are tools in the advocate's tool chest. Litigation is one of the tools, and it's been utilized. I utilized it when I sued Clonade and the Ryalians. But there's also public communication, coalitions, so many different media. And how do you use these tools to effectively move public policy or funding on a massive scale when this is such an incredible technological era that's available, an opportunity front and center, right? And with so much confusion now in the social media world, it's very, very complicated. And one of the things that I look at in the way of advocacy is always constituency building. So I'm on a board of the NFL Alumni Association, NFL Alumni Health Regenerative Medicine, right? NFL, National Football League. I always wanted to ask the Transhumanist Party, how many of you are football fans? How many are sports fans? And how many of you are just sitting around reading David's books all day? I don't know. But here's the point. We have to be able to get through to the general population. And if you understand the risk factors of sports, professional sports, contact sports won't exist in 5 or 10 years. It just won't, because as we understand and can understand on the sideline the brain damage with every hit. All right, good luck with that. We give honors every year to different groups. We call them Regenerative Medicine Action Awards or Stem Cell Action Awards. And we've given them to then former Vice President Biden and Jill Biden for the Cancer Initiative and the loftiest level, but also grassroots advocacy. So this year, we're going to give an honor to a group called Ring of Brotherhood. And it's interesting because that was formed by an African-American lady, Lisa McClellan, who's caring for her brother, Gerald, who is a former boxing champion who is brain damaged. And the plight of the fighter community is dreadful once they leave the ring. So we have organized in a way that the World Boxing Council, based in Las Vegas, by the way, is sending Christy Martin, one of the greatest female champion who has an incredible narrative herself, to be on hand when we honor the Ring of Brotherhood. Now, what does that mean to an advocate? It means this is a constituency, and a constituency is a narrative. And one thing lawyers do, it is all law is show and tell with rules. Don't tell anyone I gave away that secret. But it's presenting a narrative that people can understand and relate to. And we believe, Melissa and I believe, based on our experience, that these narratives are what can persuade people to do something. And it's not just that we're going to live forever. Great, you're going to live forever, that's fine. You have the resources, it's going to work out for you, that's terrific. But how is it going to impact everyday lives and the suffering that we see around us every day? And I would submit that we have these technologies at hand now to deploy. And if that's the case, we've got to find a way to get them to people. And how you're going to do that is demand. And how you're going to get the demand, you're going to present the education and spotlight that people realize that they have a stake in this and can actually make a difference.
Yes, indeed. And along these lines, our friend Daniel Tweed writes, it's amazing how much social progress boils down to court cases and decisions. Now, of course, there are multiple avenues that can be pursued to change public policy, and one way is to litigate a case in court and create a precedent for how the judicial branch would interpret the law. Another approach would be to actually get legislation passed, that's through the legislative branch, or change how the executive branch enforces the legislation. That would be, for instance, if the FDA were fully staffed and capable of promptly reviewing all of the applications that come before it, or if some of its processes were streamlined. But there's also another area, which is changing the public perception. You mentioned education. You mentioned essentially showing stories from people who are relatable to the broader public, and perhaps showing an aspect of their lives or how they have been suffering because of disease that many people might not have understood. So I suspect that even though football, American football, involves a lot of physical contact and a lot of injury, many people don't think about the long-term consequences of that to the athletes, and that's quite unfortunate. Now, I do want to hear your perspective on which of these avenues can have the most impact, at least in particular contexts. So when is it more useful to have a legislative victory? When is it more useful to win a court case? When is it more useful to just broadly change the culture through persuasion?
It's not a science, it's an art form. It really is a challenge. So having been involved in all sorts of initiatives, writing formal letters to the National Institutes of Health on guidances for embryonic stem cell research in public, and going to public comment opportunities with the FDA so that they didn't treat structural use of fat in a way that it had to be an approved biologic with a clinical trial, but a plastic surgeon could use that in a way as it's always been done, as support tissue. It means dealing with every constituency and understanding what stake they have in this and where it overlaps with your own, and bringing them in a common cause. And that's only something done. It comes with great problems. There's a great coalition. It's Washington-based. It's called Research America. And almost every major medical philanthropy is a member of Research America, and the pharmaceutical companies. It's a tremendous project. That's a coalition that moves the needle and honors lawmakers and walks the halls of Washington and does public support. Well, that's great, but what if it's a small, rare disease? And how does a rare disease band with other rare disease organizations to have the same clout? How do we interact with the biotechnology industry organizations so patients have a seat at the table? And it's almost as it comes, as the opportunities come, you have to be able to know who to deploy, what organizations, who's going to be able to step up, who's going to be able to write a check, if any of them, to get the narratives there. It's not easy. I mean, but this is like, this is the future of medicine, right? If this is the future, we want to get there sooner than later.
Yes, indeed. Yes, indeed. So we have a variety of tools and methods in our arsenal, but it is, as you stated, an art form to determine which ones to deploy at which time, and of course, depending on what the realistic constraints of the situation are. We have two questions that are along these lines from our friend Alan Crowley. He wonders, how do we responsibly expand biotech research, and what can an individual do to promote stem cell research? So a broader question about perhaps the trajectory of progress, as well as a more individually specific question about what can one do?
Well, an individual who supports stem cell research needs to support funding for basic research from the National Institutes of Health, should be supporting proper funding for the FDA to be able to accelerate the field. They should become part of an educated public to understand that cell therapies represent the future of medicine and be attuned to the breakthroughs in science as it moves forward. Where you see some organized effort to curb freedom of scientific research, to speak out against it, and to understand like-minded people and organizations and join them in the effort to stand up for freedom of scientific research. If you know of someone who is ill and there's a cell therapy clinical trial in your neighborhood or region, or you're at a medical academic center, to certainly be involved and encourage people to look into that, and to be an informed consumer oneself. When you see some advertisement in a news shopper saying, we have stem cells on the corner, just stop in, to be smart enough to know that that's not something that you should do. So this is a maybe general and common sense, but it worked for me. I became a stem cell advocate and bought into it whole cloth, because I thought, if in my case, it was the highest and best use of my life. It was more fun than suing people for a living every day. Insofar as supporting biotech in general, that's interesting, because biotechnology has a massive support industry, the Biotechnology Industry Organization, that looks for patient advocates to support this field. There are elements of society that really look suspiciously at biotechnology in general, genetically modified organisms and such. And while the science is certainly related, at least for myself, my focus is related to cell-based medicine and stressing the medicine side of it. And I just have to mention, because it just occurred to me, I didn't have to mention it, but all of us who have pets in veterinary medicine should recognize that this field is for animals as well, and tremendous strides are being made on the veterinary front, and probably effective treatments for Fido are closer than anything that's coming to humans right now. Where I live in this town of Wellington in South Florida, and they have a bunch of horse people across 441. And believe me, they're using stem cells on their polo ponies every day.
Yes, indeed. And the field of veterinary medicine offers the possibility for prompter experimentation, because treatments that perhaps might not pass the requirements of human clinical trials could be administered to pets more readily. And while the learning experience is not necessarily perfectly translatable to humans, I do think some significant valuable knowledge could be gained. Now, our friend John H. writes that he's surprised that more people don't approach healthcare funding from the point of view of the probable economic benefit of simply having a generally healthier population. What would be the cost impact if the population as a whole were, for instance, 10 or 20% healthier? And his intuition is it would be huge.
Huge. It would be huge. And there's the area of the longevity dividend, of which I am a supporter of. In fact, it's interesting that I am friends with a person, Dan Perry, Dan Perry was the longtime head of the Alliance for Aging Research, which is a inside the Beltway-based organization. And Dan was an incredible stem cell advocate. He's retired now, but he led a Washington-based coalition for advancement of medical research that was really at the front lines of fighting for embryonic stem cell research. I eventually became a board member there, but sort of we were the grassroots shock force supporting that. But what Dan had a hand in, I want to say it was all the way back into the late 80s, it might have been in the early 90s, of coming up with this idea with and writing a paper with other authors on the longevity dividend. And I didn't know how that originated. Now, I'm not so well versed in it that I want to spend any time talking about it myself. That is going to be a topic at the World Stem Cell Summit. But it seems to me that a large underpinning of the idea of longevity, at least with lawmakers, is you have to persuade them that living longer, healthier lives is not going to be a burden on society, but it will actually be a tremendous economic boom in many respects. And that's where the dividend comes in. We're not spending extra trillions and trillions on dealing with people with chronic medical conditions. They're productive members of society paying their taxes. I presume that's an adequate shortcut, although some of you might have a better way of putting it.
Mm-hmm. Yes, indeed. Well, thank you, Bernie. And David, you have some quick numbers that you could offer regarding the longevity dividend.
Well, the numbers are trillions of dollars. You know, if we could extend people's healthy lifespan by just 1 year, the implications, this is on average, the implications could be that we will save $1 trillion, first of all, in deferring health costs for people who are getting sick, and secondly, by having more people vibrant and participating in the economy. I'm not pulling these figures out of thin air. I'm referring to a publication that was in the Lancet recently by Andrew Scott, who's an economics professor from the London Business School. He did this jointly with some other researchers. And his view is that this argument needs to be heard more and more. After all, politicians are often worried by people staying alive for longer. You know, in one part, they want to say, yeah, it's good that people stay alive, but they're also worried about growing healthcare costs, pension costs. So sometimes politicians in unguarded moments almost say, I wish these people who are dying will hurry up and die. Now, the reality is, if we can extend people's healthy lifespan by just 1 year, it is literally trillions of dollars. Andrew Scott knows what he's talking about. And the reason I know this is I interviewed him recently. He's coming out in the very next episode of the London Futurist podcast, the discussion I did with him. And what's also shocking to me is he has written a book about longevity. It's not called The Abolition of Aging or We Will All Live Forever, because these books don't tend to sell so well. His book is simply called The 100-Year Life, how people should change in order to live potentially 100 years. And the really shocking thing about that book, he said it's coming up to selling 1 million copies, which is rather a lot more than my book has sold and rather a lot more than most people's books have sold. So this has caught the public's imagination that is something that's credible. So let's have more of this discussion of the longevity dividend. In the past, when it was first announced, when people, like you mentioned, Bernie, brought it forward, I think politicians looked at it and said, yeah, this sounds nice, but it's never going to happen because we're never actually going to be able to extend people's lives. So it's kind of theoretical and abstract. But now people are seeing some of these stem cell treatments are almost here. They're seeing the senolytic treatments are producing quite good results in other animals. There is the reversing of epigenetic aging, which Altos Labs and others are looking at. So it's not yet here, but people can believe that it's near. And so then they're going to be more interested in this longevity argument. They're going to see, well, actually, if we invested just a few $1 billion and we get back trillions of dollars of advantage to the economy, that is surely a no-brainer. So we've got to convince people that these treatments have a good chance of making some difference. We don't need to convince them that it's going to make them live 20 or 30 years longer. Even just living 1 or 2 years longer is going to be hugely economically significant. So I think this is an argument that its time has come, and I'm very pleased to hear that it's going to be featuring at the World Stem Cell Summit.
You know, talking about aging research in general, it's interesting to see who's resisting it, right? And someone mentioned earlier about this. Have you ever spent any time with a social gerontologist? Okay, well, let me tell you something. In the gerontology community, what I found is that there was incredible resistance to the ICD-11 code, where aging is treated as a medical condition, and I would submit a treatable medical condition, which is not saying it's a disease, but it's nevertheless an earthquake if you were in the gerontology community. And of course, Aubrey de Grey, who many of you know, wrote the book Ending Aging. It was influential to me, and I felt very meritorious, if not dangerous, at the time when it was written, but very, very important. And that is an accepted view of science now, that we can be able to treat aging. Very, very, very significant. But what surprised me is that health gerontologists, social gerontologists seem to be hugely upset about this. I heard Matt Kaberlin, who I would call a biological gerontologist, reporting on this with his colleagues that were of a different stripe. And the vehemence in that broadcast struck me, where one of the gerontologists said, "When I learned of that, it made me physically sick."
There are emotional things going on here. People are challenged with the possibility that if we concentrated our research, we could allow many people to live much longer. That's a challenging thought. Many people have sort of made their peace with growing old and aging, and that's how they've constructed their philosophy of life. And somebody comes along and challenges that and says, this is treatable. Ideally, people should say, well, this is good news. But often people say, no, this is messing with my head. I've already got this all worked out. This is called terror management theory. I mean, it may sound a bit strange, but psychologists have looked at it. There's a whole book, famous book called The Denial of Death by Ernest Becker, Pulitzer Prize-winning book, if I remember. He argued that, we are terrified of death at an early age. And some of us here, said, well, we're going to do something about it. But other people found a way of sort of comforting themselves. They don't need to think about it. But now when the likes of the people here, or David Sinclair, or Aubrey de Grey, or Matt Kaberlein, when they say, we could do something about it, it's sort of disruptive, and not everybody can handle it well, which is why I guess we've got to offer them a simple way forward. So we're not going to tell them, look, you're going to live 20 years or 30 years longer. We can tell them, you can have your hip repaired. You can have your macular degeneration repaired. Maybe that will be an easier win for them. And when they are cured of these diseases, maybe they'll be slightly more open to reconsidering their broader philosophy.
I just hope that we don't allow these social gerontologists who are of this mindset the level of sway that they would need to reverse some of these gains because they don't want their previous cognitive frameworks to be shattered or challenged by these advances. It really does seem to be a case of status quo bias, what you were describing, David, where people have made their peace with a certain way that things are, and they've structured their lives around it. But I do think one of the roles of an organization like the Transhumanist Party should be to get people out of that rut, and not necessarily in a manner that is forceful, but in a manner that is effective in getting them to reconsider some of those assumptions. And hopefully some of them will even watch a virtual Enlightenment Salon episode such as this, at least one can always hold out hope for that kind of effective communication reaching people who are of different persuasions. Now, Didier,
I
yes.
could say something.
Yes.
You know, it's struck me as fascinating. I just couldn't conceive of, why would a gerontologist community resist, aging research, and and it's like, the only thing I can think of is, well, if gerontology is like the study of aging and it's no longer, maybe they're worried about being obsolete. It's like the thing I'm studying doesn't exist anymore. I don't know. It just struck me as an odd thought. Go ahead,
well,
Johnny.
That would be awfully short-sighted of them, because anytime there is public attention to a field because something can be done about some of the main subject areas, like think about advances in generative AI right now, that field becomes a growth industry. And longevity is becoming a growth industry as well. And again, it seems to suggest a lack of creativity on the part of these people. So,
well, lest I don't want to be quoted as of savaging every social gerontologist or health gerontologist, but certainly in the leadership of that debate, that seemed to be clear. And the people I talk to speak of this as if it's a real issue. I'm not so tied in the gerontology community to know for sure. But as general, when there are novel and new approaches, usually there's some group that might feel threatened in some way. And sometimes it's very much when you're looking at what it means to them economically, if nothing else. I think the greatest thing for the longevity dividend is to ban pickleball. Because if you live in a community of people that are a little older, such as population of Palm Beach, Florida, they're going to the hospital every day. It's the greatest thing that ever happened to the orthopedic community. Just saying.
Interesting. Yes, I am aware of pickleball being a fashionable activity. I would say
I don't know about fashionable is the right word for it, but that's okay.
Yes, well, I'm
sorry to digress. That was one of my digressions. I apologize.
Oh, no problem. I'm seeing pickleball courts being established in more areas, and it does seem that a certain demographic really favors that pastime. Now, our friend Didier Cornell was intrigued to hear more about stem cells and healthy life extension for mice, because, of course, mouse life extension is a major pursuit right now within the longevity community, and dramatic results showing effective life extension in mice can garner public enthusiasm and show that perhaps similar breakthroughs are not out of the question for humans. And we do have the robust mouse rejuvenation study that's currently ongoing. That's the Longevity Escape Velocity Foundation, with which that means Bernie, David, and myself are involved as well. And one of the treatment arms in that study is a stem cell treatment. But Bernie, are you aware of other endeavors that seek to pursue some sort of cell therapy for mice?
Well, I'm going to actually defer to you and to David more on that. And by the way, hello, Didier. I remember meeting you in Dublin. It's good to see your face. But I think you explained it well. In broad, sweeping terms, it seems like there are a lot of lucky mice these days.
Yes, absolutely. And for those who are interested in learning more, I would recommend going to levf.org. And there is a page that provides a detailed description of the robust mouse rejuvenation study. Here is the link to that page, where all of the parameters of the first study can be found, including a discussion of the stem cell treatment that some of the mice are receiving, and some of the mice are going to receive that treatment in combination with the other treatments so that the potential synergies between cell therapy and other approaches can be studied. This is really a groundbreaking set of experiments, and to my knowledge, it is the most major combination lifespan study that has ever been undertaken in terms of exploring not just the effects of one intervention, but the effects of multiple interventions. So definitely check this out if you have not read about the robust mouse rejuvenation study yet. Now, we have about 13 minutes left in our virtual enlightenment salon today. So I would like to give as many people as possible the opportunity to ask some questions. I wanted to ask you, Bernie, with regard to your discussion of boundaries, would you say the proper way to define boundaries around technological progress to be whether it serves human well-being or detracts from human well-being? So, for example, technological progress can lead to abundant clean energy through nuclear power, but it could also lead to weapons of mass destruction, and it's a slightly different utilization of that technology. You can't readily convert one into the other, but one use is clearly for human benefit and the other use is clearly to harm human beings. So would that be the definitive criterion for the setting of those boundaries?
Well, that is such a loaded question. You know, I'm looking forward to the new movie they're coming out with on Oppenheimer. So maybe they'll be wrestling with such issues in his famous life. I think, of course, we look for the beneficial use of technology, but it depends on one's point of view. Some would say, well, we want to use this nuclear deterrent because we have to have it. In a world of dangerous nation states, we better have ours. So that's the world we're living in now. I think, to me, as I was thinking about this chat and the invitation, of what my concerns are related to the advent of these new technologies. And of course, the elephant in the room, to me, is the specter of eugenics, and how people who are supportive of all of these new technologies and the possible creation of, quote, better humans, how does that jibe with our species and the lessons from history? And my general readings over a lifetime and my interests are not so much science, but it has been history and to a certain extent politics. And I was very influenced by a book by Edwin Black called War on the Weak, Eugenics and America's Campaign to Create a Master Race, about the American eugenics movement. And if you want a deep dive into the disaster of the Holocaust itself is that book of Into That Darkness by Gita Serini, about the commandant of Treblinka, the death camp. And no book really underscored the hideous nature of that. I was also influenced by a book called The Immortalist about the Carrel and Lindbergh and their own views of creating living forever. So I think that we have to understand that those issues are a concern, and actually a legitimate concern in a genocidal world. And in a world of nation states, where some are going to be using these technologies for geopolitical purposes, one over another, how do we put how do we get our hands around this in a way that the uses of this are going to be beneficial, but not misused in some incredibly bad way, of which Taleb would say is a black swan. We think about it in general, but we don't know what the event will be, the random event that's going to hit us. So these are the things I fret about a little bit when I think about the technologies that we are all so supportive of. And I'm wondering if the Transhumanist Party itself and the thinkers that are on this call might be able to answer that question for me of how do you deal with it?
Well, I would envision transhumanism and the human enhancement that we advocate as being the opposite of the eugenics of the early and mid 20th century, because those eugenics movements advocated essentially disempowering or removing from society or sterilizing people who were considered unworthy or undesirable. And we advocate the opposite of that. We advocate uplifting all human beings, including people who suffer from diseases and disabilities or who may have genetic predispositions to harmful conditions. We don't want to remove them from society. We want to make their lives better. We want to raise them up to a level not only comparable to present-day healthy functional humans, but even something better. I think one of the great promises of transhumanism is that it says you don't have to have won the genetic lottery. You can take charge of your own evolution. You can make yourself better without being subject to these constraints of your own birth or the evolution of your own lineage, because those constraints, they're not what determine human worth. The character of the individual, the motives of the individual, the willed achievements of the individual, those are what determine human worth. And we want to give all humans the opportunity to do that. Of course, that means these technologies need to be advocated. They need to be made more available, more affordable, with fewer barriers and restrictions to their application and deployment. But just as with a lot of other emerging technologies, smartphones, computers, the internet, and earlier automobiles and electricity, even if initially they are only available to some people, over time, if they're effective, if they're desired, and there is the opportunity for a market to emerge to fulfill that demand, then more and more people will have access to those technologies affordably. So I don't think the transhumanist vision would ever lead to a class of, quote, superior human beings who are oppressing a class of, quote, inferior human beings. That's rather the state of nature. And we want to get past that. We want to transcend that. So that would be my answer in regard to the transhumanist vision.
Yeah, and we do have a lot of support for the individual personal freedom over their own body. So I would think that we would probably want to take a stance that the individual would trump any thing from the state, and that it's not a super good idea for the state to be coming in and saying what the genetics should be. You know, we put that freedom into the individual. But it's such a good question, because what will happen? Will this sort of supersede the race debate? Will this hopefully maybe obsolete some problems? That would be, but like you said, it could go the other way, maybe, but and it's so complicated, because what if we're talking about some kind of disease and the state is going to say, okay, from now on, we want everybody's genetics to be immune to, the mumps or something, so we can just get rid of mumps? Is there a slippery slope there? Then could the state say, being some kind of race is now something we need to, get rid of, like mumps?
So Jason, slippery slopers. The slippery slopers. I debated all the slippery slopers.
Yes.
Everything's going to be a slippery slope. Well, what are we going to do? Put on boots.
the debate that Jason is mentioning is essentially the controversy over mandatory vaccines that we have experienced over the past few years. And my general outlook on this is I strongly favor individual choice and individual freedom as long as that choice does not directly infringe on the rights and safety of others. So right now, what we know about COVID vaccines is that they are strongly protective of the individual, though they don't protect against infection per se. And in my personal experience, I've had an unfortunate breakthrough infection, but still, I think they helped me to greatly minimize the harm of that infection. So if it's a choice that primarily and fundamentally protects the individual, then each individual should be empowered to make that choice. Now, if there were hypothetically a disease that would be so contagious and so deadly that if you came into contact with somebody who wasn't protected from it, you would be sure to get it and you would be sure to die. There could be a case for mandatory vaccination there, but I don't think there would ever be a case for mandating a human enhancement that solely makes the individual's own life better or even less painful, less harmful to the individual. That should always be a choice that is left to the individual. And I think most individuals would make the choice to pursue the enhancements if they were reasonably safe and reasonably effective. But there could be people who choose to abstain, and we need to respect their individual rights to do so as well. So we have about 2 minutes left in our virtual enlightenment salon today, and I would like to invite Bernie to make any closing remarks. So Bernie, what else do you think should be mentioned in our salon today, or what response do you have to any of the comments that were provided, or anything that perhaps could be said to take this conversation a bit further?
Well, I'm so grateful to have survived the star chamber of the U.S. Transhumanist Party and seemingly come out in one piece. I'm a small L libertarian in my point of view, and was a great proponent of the late great Harry Brown back in the day, which revolutionized my thinking as a typically social liberal student when I started off. But what I want to say is actually not about any of the science. And of course, I want you all to come to the World Stem Cell Summit in Winston-Salem, June 5 through 9. Very inexpensive. You're on the East Coast. Come on, just come down. It'll change your life forever, for the better. Okay, having made that commercial, I just want to say it's very interesting. The U.S. Transhumanist Party is very interesting to me. And having delved into independent political parties back in the day and been an independent and looked at politics in a very different way than perhaps others, you've got your work cut out for you. But in looking at your charter and your principles, they're so universally pure. It did strike me that you're on the track of something. As long as people can understand that that this is for everyone, and that is not trying to be imposing on someone, but is actually a solution. It's a party of the future, right? It's the real forward party. That's going to be interested in how you brand it and how you move it forward. It fascinates me. I want to thank you for the opportunity very much to be on. I hope I can be on again. I'm an exhausted volcano. This has been a long day. Melissa, I don't know if Melissa is still there. Maybe she would have some a closing remark.
Yes, Melissa, if you...
Thank you. Go ahead, Gennady.
Yes, we have about a minute, so we will let you offer any closing thoughts that you have during that time.
Okay, thank you. I'm trying to go somewhere more quiet. I just thank you all for having Bernie here today as the main spokesperson. I apologize for being in transit and not really being in a stable place to speak with all of you, but it's just wonderful always to be with people that are so interested in the intricacies of the science, what it can bring to society, and then all of the surrounding issues. And I think the questions being asked by Jason and others today have just, and David as well, have just really nailed a lot of the troublesome or confounding intersections of the technology, policy, politics, funding, business, people, healthcare that we're all faced with. And it's thrilling to be with a group like this that's so interested and engaged and knowledgeable, and also wants to help by perhaps joining our coalition, steering other people toward joining our coalition, come to the World Stem Cell Summit, be an educated consumer of healthcare, and particularly still relatively new technologies like stem cell research, even as combined with gene therapy these days. It's like science fiction, and people are being cured, but unless it's all the way through the FDA, it's just not safe for you to do anything other than participate in an FDA path clinical trial. Thank you.
Yes, thank you, Melissa, for those good words. And we hope to have you back on a future salon. We hope to have Bernie back as well. And in the meantime, thank you to all of our viewers and our panel. Live long and prosper.
Thank